everyone. Let's talk about alcohol today. If you are a person that is curious about your drinking or potentially contemplating on reducing, this may be the video for you. Did you know that the guidelines surrounding drinking have changed so much since 2023? And so when we look to the past, alcohol, it was also oftentimes said that, it was safe for like 10 to 15 drinks a week, when our new research is showing that zero is actually better. And a lot of people feeling more health conscious, more financially conscious. Alcohol is something that we can take a look at to make changes to, whether or not you identify with a problem. But for those of you with a problem as well, the best way to gauge it with our new guidelines is that if you are drinking more than 3 drinks a week, 3 to 6 drinks a week are a moderate risk for building a tolerance, a dependency, or a problem. 7+ drinks a week is risky drinking and problematic drinking. And so just take a moment to sort of check in as to what the last week or 2 or maybe the month look like for you and your drinking. And if you're more curious, follow ahead. So if you are identifying in the moderate to severe realm of drinking, best practice is to try to start to reduce or abstain. Now, if you have been drinking for 1 to 2 years plus, pretty excessively past the 7 drinks a week guideline, you may want to check in with a medical support to safely reduce. So we don't oftentimes recommend going cold turkey because there's a variety of emotional and physical issues that occur. So some people benefit from calling telehealth, which is a 24/7 free support, connect with a nurse, a doctor, and just to tell them a little bit about their situation and their health, or connect with your doctor, go to a walk-in clinic, a RAM clinic, and what they will do is work with you and also perhaps prescribe some medication that just needs to be temporarily so you're not at risk of any seizures, anxiety attacks, or to support you with sleep. Because when somebody decides to reduce or abstain from alcohol, they can experience withdrawal. So again, depending on how long a person's been drinking for, withdrawal can last anywhere from 3 days to a couple weeks for folks. It can be a really uncomfortable period of time where people notice an increase in anxiety, a dip in depression, sometimes suicidal thinking, which can be normal or abnormal for that person. They can experience disrupted sleep and even start dreaming again, because alcohol and a lot of drugs, they disrupt our REM cycle. And so when people abstain, they start dreaming, and some of the dreams can be quite overwhelming. And so that might be something to unpack with the support too. But the most important thing is withdrawal. After this time passes, people usually report better thinking, more clarity, problem solving starts to return, decision making, and so areas of their brains and skills that you naturally possess will start to come back online. People will also feel better energy and more stability with their mood. And so the important thing to acknowledge is what you feel in the early stages of abstinence or reducing is not what sobriety feels like long term. That feels very important to say. And then there's the concept of the dry drunk that I like to talk about. So this is taken from the realm of AA, and this is the understanding that for a lot of people, it's not enough to just stop drinking. You have to deal with the thoughts and feelings that come from that. So for some people, they are drinking to sort of mask or deal with something that's happened in their past, or when they stop drinking, they have to deal with everything that's been going on in the process of them drinking, whether it's fractured relationships, physical health issues, emotional issues. So the concept of the dry drunk is that you have to not only stop the behavior, but deal with the thoughts and feelings, because if you don't, you're at super high risk of relapse and going back into the drinking. So if this resonates with you, or if you are curious, like how do I know if drinking is a problem for me? Ask yourself these questions. Is when you start to drink, do you have a sense of control over it? So if you set a limit, do you oftentimes abide by that or pass it? The next question is, do you overconsume? So do you set an intention for what you want or how long you'll drink and then blow through that? So do the brakes stop working? That can be an indication. Do you experience cravings, so discomfort when you do reduce or try to stop for a period of time? And have there been any negative consequences in your life? Are you noticing any shifts in your physical health, your emotional health, your relationships? If you're answering yes to more than two of these, there is a chance that you are identifying with a moderate to severe problem drinker. And remember, alcohol is oftentimes a symptom of a much larger issue. And so sometimes we over-focus on the symptom when we have to focus on the emotional impacts of whatever you're navigating and whatever you're going through. And know that the body keeps the score. Bessel van der Kolk talks a lot about that. He has a wonderful book, kind of sciencey, but very wonderful book. But the idea is that alcohol is a depressant. And so it's literally suppressing our emotions and experiences, whether it's in the here and now or in the past or in the future, and we are not dealing with them. When ultimately we have to learn to bring these feelings and experiences to the surface, understand them, and let them pass. We cannot do that if we keep shoving them down. And long-term effects of shoving it down, especially with alcohol, is that our emotions, they oftentimes attach to certain organs in the body and start to weaken them or shut them down. And so if you're starting to notice physical health issues with pain, the body just feeling generally unstable and disruptive, that is certainly your body screaming at you and trying to get your attention to make a change. And it's something to take so seriously, because certainly with alcohol, there is a continuum that once we pass a certain threshold, it's really difficult to get parts of ourself and our health back. So we have to take this seriously. Remember, best practice is 0 drinks as much as possible for as many weeks out of the year as you can. And if you are having any challenges with it, please reach out for support. Like, there are so many trained professionals and groups available to you online for free, paid as an investment into your well-being, that are there for you, because recovery is not something that we're successful at on our own. That's all for now.